And our last speaker for this session is Dr. Robert Zarr. I've known Dr. Zarr for a number of years. Many of you know that he has really been the champion as the founder and the director of the Park Prescription America program. And we are excited to have him here from Unity Healthcare. He's a board-certified pediatrician. So I've got your microphone here, and it's all yours.
Thanks so much. Appreciate it. Thanks for having me. I really enjoyed the previous two presentations. Sorry I couldn't be here earlier today. I was actually seeing patients this very morning. It is true I'm a practicing pediatrician, but what I have to tell you is not child-centered, okay? I'm here to scare the hell out of you, okay? So what's going on today in the US is that we are dying prematurely, and we are suffering from chronic disease. What the hell does that mean? What it means is that 70 million Americans have a diagnosis of high blood pressure. High blood pressure leads to heart attacks and stroke, right? Commonly. Many other problems, but those are the two ones you think of. We have 70 million suffering from high blood pressure. How many people live in this country? 300 and something million, right? Okay, add to that 30 more million who have a diagnosis of diabetes. Diabetes. What happens when you have diabetes? So your risk of a heart attack is 25 times more. That's 2,500% increase, okay, when you have diabetes. Among many other things, diabetes definitely increases your risk of heart attack. Amputation, claudication, a lot of problems that result from diabetes, early death. Add to that 10 more million that have a serious mental illness, like depression, anxiety, PTSD, right? These are serious burdens on us as patients, on us as physicians. Now add to that another 100 million. These are not all different people. These are sometimes the same people with more than one diagnosis, right? But add to that another 100 million Americans who have a diagnosis of obesity. Have I scared the hell out of you? Okay, this is the path we are going down. We've had a doubling of pediatric obesity in 20 years. It's not getting better, right? What do we do when we're indoors? What do? We sit. Raise your hand if you've been on your cell phone during the previous two speakers' talks. Come on, raise your hands. Be honest, right? What do we do when we sit? We're more likely to get on our electronic device, right? What do we do when we go outside? What do we do? Is it a little harder to drink or to eat when we're walking? Just a tad bit, right? Is it a little bit harder to text or to do your emails when you're walking? Just a little bit, right? So there's some science to this. Believe it or not, researchers across the country and across the world have shown that when you're outside, you're more likely, hello by the way, good to see you, you're more likely to move. Common sense, right? Okay, wonderful. So I've scared the hell out of you, but now I want to cheer you up a little bit, right? So there's a lot of good science. There's nothing to look at. There's no reason to look at this screen right now. I just put it up there. That's my home page, all right? You can look at me. It's okay. Eye contact is okay. I'm finding that in my patients and in the parents who are the parents of these patients, there's no more eye contact. It's this, and we're seeing sort of this. This is I'm calling it sort of an artificially looking autism is what I'm seeing. Okay, these are not kids who are born with autism, but our social skills are changing. If you haven't noticed this, look at your grandchildren, look at your kids, look at your friends. They're having a harder and harder time to actually have eye contact and have a conversation with you. And I think in part because there's a lot less social interaction, in part because we're not really in situations like being outdoors, right, in groups, that really are enhancing that sort of social aspect of who we are as a species. Now, there are researchers all around the country, all around the world, that are looking at the health benefits of being outdoors. Now, I didn't learn this in medical school. I didn't learn it in residency. I didn't learn it when I got my master in public health. I just gave him my CV, right? Didn't learn any of that. It took the National Park Service. It took the U.S. Forest Service. It took individuals who are not physicians, who are not specialists, who are not in public health, to educate me about the meaning of One Health, to educate me about the science out there, the scientists who've been showing these direct health benefits. So what have we learned? We've learned that there is a restoration of attention, an increase in your focus when you're outdoors, right? Now, I'm not talking outdoors where you sit on a park bench and do this, right? I'm talking about an outdoor experience that's a little bit more mindful, using your senses, listening to the birds, right? Smelling, touching, paying attention to what's happening outside of you in a natural setting. So attention is extremely important because that's what we're all tasked to do every day, right? Not just doctors. All of you in this room need to send a coherent email, right? And you need to be focused and know what you're sending before you push that send button. We know from research that's happened in Japan, in Norway, other countries across the world, even in the US, that there is a change in your blood pressure, there's a change in your pulse, there's a change in your heart rate, your respiration, your stress cortisol levels, hormone levels, when you're in a forested area. The Japanese have been doing this for 3 decades. They call it forest bathing, or shinrin-yoku. It's been going on for thousands of years. There's good science behind this. Before you go on a forest bathing guided walk, they take a swab of your cheek, measure your cortisol level, they take your blood pressure, and they do it again after the walk. They have thousands and thousands and thousands of points of data that have shown very clearly a drop in your stress level. There's 3 things that are killing us, that are causing chronic disease. 3 general areas. 1, diet. The way we eat, how we eat, do we harvest our own food, the food quality, we can go in a lot more detail about that, which we're not going to. The second thing is inactivity. We sit a lot, right? And then the third thing is chronic stress. What the heck is chronic stress? Our lives are stressful, right? Being on an electronic device all day and waiting for that email to come through, or that text to come through, or wondering what the response is going to be, or seeing 24 patients in a day, going home, having to cook dinner quickly, get the kid to bed, get him to school, that's stress. So you have to be able to manage this stress. And one of the best ways to manage the stress is by using science, evidence-based research, and implement that in a setting where it's being done anyway, right? So now you can look at the screen. So what I've done in the last 8 years is make it easy to work with park agencies, local, regional, National Park Service, U.S. Forest Service, et cetera, to take this wealth of green space around us and make it prescribable. This is about a park prescription. So I'm the founder and medical director of Park RX America. RX means prescription, right? So the idea is to take this wealth of green space and to make it easy to prescribe because we know it's the right thing to do. We, in fact, know there's a lot of science that shows that spending time outdoors impacts in a positive way inactivity, chronic stress, and diet, believe it or not, right? Diet? Yes, diet. We know that we have the parasympathetic and the sympathetic drive in us. Parasympathetic is when you're quieting down, not right now for me, I'm sympathetic drive right now, fight or flight, right? Parasympathetic is when you want to eat because your digestion goes better when the parasympathetic drive is in its height, right? We know that being in nature increases that parasympathetic drive. So even diet, as simple as digestion, improves in an outdoor quiet setting. You tend to eat more slowly when you're out in the park. Try it if you haven't lately. So what you're looking at right now is the interface that providers, health providers, doctors, physical therapists, psychiatrists, case managers, anybody who's delivering some sort of health service has at their fingertips while seeing patients. Do I have time to share a quick example, or is my time up? No, I have some time. So I wanted to show you a couple of examples. So I saw patients just this morning. I saw an 8-year-old who, name I will not tell you, but who went up 17 pounds since the last time I saw him, one year ago. And his BMI, body mass index, measure of your obesity, is at 97%. So in children, we distinguish in percentiles. It's pretty high. And the things he likes to do outdoors, I asked him, what do you do outdoors? What do you like to do? I don't know him very well. I saw him 3 years ago. We kind of got lost to follow-up, saw somebody else. He's not one of my dear patients I've seen for 17 years, okay? But we have enough time in that 15-minute visit to delve into this a little bit. He says he likes to swing, and he likes to draw. I said, well, can you draw outdoors? He goes, yeah, I can draw outdoors. So I use this, and Ben, if you want to type in up there, you know, any address, 3020 14th Street Northwest, whatever you like, something in this area, and press go. And so I did this in a matter of seconds. We got down to really a couple of parks in his area. And his parents were there, and we talked about what they could do. What happened? Oh, yeah, it'll come. So just go down and tap Ben, tap one of those addresses down below. It doesn't really matter. Any one of them is fine. Yeah, and now press go. Don't worry. We have 3,000, it doesn't matter what address. We have 3,200 parks in our system now. We started out with 20 parks around one clinic. We're now in Anchorage, Alaska. We're in Washington State. We're in D.C. We're in Maryland. We're in Virginia. We're soon to be in North Carolina, South Carolina, Rhode Island, et cetera. So I'm showing you something that we just did today. And we clicked on a park. So click on any park. See those red buttons there? Click on any one of them, just for a second. Pull up View Park. In fact, that was one of the ones I prescribed today. This is near his home. And you have a picture of the park. It's familiar to the family. Yes, I know that park. Yes, I feel comfortable here. Yes, I want to go there, okay? And it's got a quick idea of what's there to find, et cetera. And you can X out of there, Ben, go back to the previous window. See it says Fort Slocum there? So what you can do is go to the right. Usually it's going to show up on that list, but we're not. Go down to 0.5 or 1 mile on the top left over there. Ben, go up to the left. Up to the left. Click 0.5 or 1 mile and press go. And while Ben's doing that, what we decided to do is we actually wrote a prescription. I want to show you what this looks like, real time, so you can see it. It doesn't matter. Click on any park. Click on Powell. We actually did Powell Recreation Area. Click on, see to the right, it says Powell Recreation Center. Go over there. There's a box to the right of it. Keep going. Keep going. There it is. Click that. Click Prescribe down below. Click Generate Prescription Text. Type in activity, walk with parents. Keep typing. Frequency, down below. Ben, you got to practice your typing skills here. Frequency, every Saturday. Duration, 60 to 90 minutes. Go down, hit send text. Anybody? Cell phone. What's your cell phone? What's your cell phone? Anybody's cell phone? 828-707-3549. Did you hit it? Oh, you already put it in? Copy text. Copy the text, Ben. There it is. You're done. So I put that into the electronic health. I can't pull up the electronic health record. That is a prescription for what? What is it for? I'm hearing all these mutterings, right? For walking, for outdoor, for health, for hypertension, diabetes. This kid has obesity. His parents have obesity too. I didn't calculate their BMI, but I can tell you by looking at them, they need to walk, right? So this has been texted to them. There is a unique generated code for every prescription. Everyone says ParkRx America, and the specific activity and duration and frequency is now documented in the electronic health record, and we're going to see this patient back in 1, 2, or 3 months. Questions? Is this complicated? Can any provider in the United States of America prescribe a park? Pretty much, right? So think about all the urban areas where we have people dying prematurely and suffering from chronic disease who could use a park prescription today. Think about that. I went through those numbers with you, right? 1 in 3 Americans is suffering from at least one chronic disease and gonna die prematurely. I guarantee you that. We know the stats, right? And you can do something about it. And let me tell you something. This is not instead of your medication. It's not instead of going to the cardiologist, right? The referrals we do. This is in addition to. But I have to tell you, on many occasions, when I do this, there is nothing else for me to do. Am I going to put an 8-year-old on an antihypertensive medication? Am I going to send an 8-year-old to a cardiologist because he's overweight? No. So in the past, we were doing this advice. I want you to eat better, exercise, I'll see you in a year. What happens? You come back and you weigh 20 more pounds. That's what happens, right? So the doctors get it, the physical therapists get it, the therapists get it. If we don't do this, they're only going to go down that path of chronic disease and early death, right? For most American cities, parks exist. For most Americans, they are accessible. When they're not, we need help to deal with that issue. We've got great partners like the U.S. Forest Service, the National Park Service, and RPA, on and on and on, to help with that. But right now, in this city alone, we have 400 parks. Go out there today and see how underutilized they are and how much we need them. So I wanted to give you a glimpse. My time is probably way over. I wanted to give you a glimpse of what this looks like. I have stated a problem. I have shown you the evidence that supports doing this, and I have shown you how incredibly easy it is to do. Imagine a world where you have millions of providers writing prescriptions to their patients, following them up, and watching them improve. Thank you so much.